physiotherapist from MyPhysio2Go. Our newly created channel is to help you understand your injuries and give you the tools to help you recover. In this video today, I will be teaching you about the core. You've probably heard the term core thrown around and frequently do core exercises as part of your routine for that six-pack flat stomach look, or you just do it because it's supposed to be good for you. Well, today I will tell you what the core actually is and why it is important to use this muscle daily and how to do it properly. Before we start, I will show you what the core looks like.
There is the inner core and the outer core. The outer core is a group of three strong and powerful muscles that attach the ribcage to the pelvis. They don't attach to the spine, and their main purpose is to move the trunk. It is made up of the rectus abdominis, also known as the six-pack, the external and internal obliques. The inner core is the most important part of the core to know how to contract because it stabilizes the spine and prevents the trunk from collapsing. Without proper contraction, especially during sport, a lot of extra compression, shearing, and rotational forces can injure the spine and its surrounding structures. As well, the more stable the core, the more power you can generate with the arms and legs. The inner core is made up of four muscles arranged like a box. The diaphragm is like the top of the box. It attaches around the rib cage and spine. The transverse abdominis surrounds the sides and back along with the multifidus, which attaches along the spine at the back. They are like the sides of a box. Contracting the TA is like squeezing the box from all sides, much like squeezing a juice box. The pelvic floor muscles are at the bottom of the box. This group of muscles has connections all over the bottom of the pelvis, securing the pelvic bones.
The inner core needs to be constantly contracted at a low level during normal daily activities and contracted more during strenuous activities. Now let's learn to contract the core.
First, we need to be able to find neutral pelvis. So the easiest way to find this is to first stick out your bum as much as you can, then tuck in the bum as much as you can. So move between these two extremes a couple of times, then just settle in the middle of these two movements. So mine is right about here. So this is neutral pelvis. If this is hard for you to do, there's also another way where you're sitting on all fours, and all you do in this position is same thing, you stick out the bum and then you tuck the bum in. So moving between two extremes and then you settle somewhere in the middle, and that is neutral pelvis. So now that you know what neutral pelvis is, lay on your back and have your knees bent and have your fingers just in the front of your pelvis where you'll feel two pointy bones in the front, and you're just gonna move about an inch towards your midline. So rest your fingers there, kind of feel around and feel how it feels like underneath your fingers, and you'll feel that it's kind of soft since everything is relaxed right now. So now I want you to imagine that you need to go pee, but there's no bathrooms around, so I want you to contract those pee muscles. After that, I want you to imagine that there's a candle straight up on the roof and you want to blow out that candle above. So you want to give a quick, forceful exhale, just like that. And pay attention to what it feels like underneath your fingers. You should feel a quick tightening under those fingers, and then it relaxes as you release that exhale. So let's try that again and feel that tightening. So our goal here is to be able to hold that tightening under your fingers while you breathe normally. If that exhale didn't work, try a cough or a fake laugh, and then you'll feel that tightening underneath your fingers. So with that, you want to watch that you're not sucking in like this, where your rib cage draws up and your belly just collapses into the center there, and you're not bearing down where the belly just blows up in the middle. Okay, so it's just a tightening and a stiffening, almost as if there's something compressing the middle of the torso, like a corset. Okay, so let's try that again. So you're gonna have the fingers just inside the pelvic bones there. You're gonna tighten up the P muscles and a quick exhale and hold that contraction. Now what I want you to do is you're gonna imagine the muscles in the small of your back just gently tightening as if you're trying to push that lower back into the bed, but not really moving. So that's contracting your multifidus muscle, the muscle that is the back of that box. There. So now your entire inner core is contracted. So you have to practice this over and over and over again, because this takes a lot of practice to understand how to do it completely before you're able to advance the exercises. So this muscle should be contracted at a low level throughout your day for any of your daily activities like walking, talking, going up and down stairs, even sitting, it should be contracted. But when you start doing more strenuous activities, you should be able to feel that it needs to be contracted at a higher intensity. So the harder the exercise, the harder you should have this muscle contracted. So I'm just going to give you a few progressions for this exercise. If you feel very, very comfortable with how to contract this muscle, let's show you how to do some limb movement while contracting this muscle. So we're going to start with some simple alternating knee lifts. So let's contract that core muscle, and keeping that knee at a 90-degree angle, you're gonna lift the one leg, then the opposite leg. So with this, it helps to keep that finger on the pelvis bones, and you wanna make sure that there's no shifting of the pelvis, and you shouldn't feel the bone move side to side as you lift one leg and the other, okay? So it should be stable, then up and down, and up and down. If you find this to be easy, there's another progression. So what you're going to do with this one is you're going to have your legs up in 90 degrees. So this is again a higher intensity exercise, so this should be braced a little bit more than that first exercise, okay? So tightening it up, then you're going to do alternating heel taps, keeping that knee at about a 90-degree angle up and down. So you're just going to tap one and then the other one. So keep these shoulders relaxed. There's a tendency for people to want to tighten up that shoulder as you get to harder exercises. Again, if this is too easy for you, then you're going to do straightening the leg straight down and back up. So watching for that two pelvic bones remaining stable and not moving. What's another important point with this exercise, or with any of these core exercises, is that you want to imagine that power coming from the core and not really using the leg muscles as much. If you concentrate on doing that, you'll feel that it actually takes less leg muscle work and more from the core as you get into harder exercises.
So that's it for this video. I hope this helped you figure out the core and how to contract it properly. Please click on the like button if you enjoyed this video. See you next time.